welcome to the Pause It podcast. I am Dr. Sam, and with me, as always, is Dr. Robert. How you doing?
Hey Sam, how you doing?
I'm doing great. Look, it's just me and you today. This is so
I, you know,
fun.
I was, I'll say the same thing. I'm like, it's been a while since you and I have talked, so
I know.
we love our guests, but it's really great just to get some Sam and Robert time.
It is. I know. It's like back to our roots. I kind of love it. So it's
Yes,
nice. We get to just have our weekly chat at the very least.
exactly. It's always good. So I look forward to it every week.
I do too. I do too. It's like one of my favorites. Um, so we have a really important thing to talk about. It's pretty rare that we get some new scary thing that we have to nail down. What's going on in the world.
I know it's kind of funny because it's everywhere right now. And if you don't
Yeah.
know what we're talking about, there's that infectious respiratory disease that pets are getting right now,
Mhm.
and it's in the media.
Oh yeah.
It's on social media. It's
Mhm.
a little bit everywhere right now. We have actually owners. I'm not sure about you, but are they calling into your clinic as well?
Every day. And a lot of them every single day in the exam room are like, so what about this new virus? Like, what's going on? What's this new disease? And like some people are sure it's a virus. Some people are like, what's this new, whatever. And I'm like, well, so that's what we're gonna really kind of dig into today. I think it's interesting because I'm in the Midwest, you're in California. I'm
Yeah.
in general practice, you're in emergency. So I'm going to go ahead and, I mean, because California is one of the places that I feel like is talked about it being out there a bit more, especially, where compared to Indiana, it's not really been reported. Well, that's not true, but it's not to the same extent as everywhere else. So I guess I'm curious what you're seeing. Well, maybe we should kind of roll that back a little bit. Maybe we should start with just what canine infectious respiratory disease complex is, and then we can maybe get into that first.
Yeah, I think that's a good place because that's what. So I think for most people, canine infectious respiratory disease complex, or it's called like CIRDC or whatever. Is that what it's called?
CIRDC. It used to
Yeah,
just
it's like
be like your eyes, like,
right.
but what everybody thinks of it as is kennel cough. I mean, that's the
Mm.
colloquialism, right? And I think
Yeah,
feel like we did a podcast one time where we talked about kennel cough.
we might have. Well, we've had over
It's
50
been
of them.
over a
So
year. But but like I think it's a good idea to maybe remind people like what does kennel cough look like? How do
mm,
you treat it? What do you expect? What's the course of disease? Like, so yeah.
yeah, I think it's a really good place to start because kennel cough, just for the basics of it, is an upper respiratory infection, but it's like a culmination of many different bugs.
Hmm.
It's not just one that's causing the problem. Oftentimes, it's multiple that are the
Right.
issue, and 95% of the time, it's self-limiting, which means that
Mild,
you
self-limiting.
exactly you don't need to
Yeah.
treat for it.
Yeah.
And it's so funny because I think the number one complaint every owner comes in for is my dog has vomited 50 times. First of all, not possible. It's like if your dog is vomiting 50 times, it's not truly vomit. It's probably kennel cough. That's always my biggest red flag for a lot of these owners. They're always like, they vomited like 40 times in the house. Like they're so dehydrated. And it's like, I'm like, is it little foam piles? And they're like, yeah. I'm like, are they going this yeah noise? And they're like, yeah. And I'm like, that's kennel cough. And they're like, no, it's not. I'm like, yes, it is.
You're like,
So
it's
I think that's
hacking,
fun.
it's not vomiting. Yeah.
It's so funny. And because my techs will try and tell the owners that to save them some money, be like, hey, it's kennel cough. You can go home if you want to. And they're like, no, they're vomiting. They have a foreign body. I'm like, okay, we'll talk. So,
You're like, so
but
no foods actually come up ever, not one time.
right, it's like
You're
every once in
still
a while,
pooping.
it's like
Not more money.
a kibble will show up every once in a while, but like
Yeah, right. Yeah.
pretty rare. And but yeah, so it's very funny. So kennel cough, self-limiting disease. You really don't even need antibiotics for it. Occasionally, I'll give a cough suppressant to help them sleep at night, but I tell them only to give it at night because you want to bring that stuff up.
Yeah.
It's a
You
very
don't want to
natural
suppress a
response.
productive cough.
Things that you want them to cough. It's really annoying. We get it. And the only times to really be concerned about it is that probably I can't give the exact number, but it's very small. But probably 1 to 5% that it does turn into pneumonia.
Yeah.
That's when your dog usually stops eating. They actually have a visible time hard breathing. Those are the red flags
Or
that I
even
just
sometimes they're just lethargic. They're like not like they're just like they're punky. Like
Yep.
your run of the mill kennel cough is like I'm jumping around, I'm happy, I'm eating, everything's good, I'm coughing and I'm coughing stuff up and then I'm keeping you awake, but I'm really fine otherwise. Like that's kennel cough. And yeah, people really do. They get so upset about it and you're like and those people are like, no, they like need antibiotics. I'm like, they really don't like at all need antibiotics, I
They
promise.
really don't. So, but yeah, I agree. I think it's so something we see a lot of everywhere across the
Yeah.
country, and that's kind of where I think a good transition is to the next issue is where
Well,
the
and I
debate.
think, and I do think like one thing that is maybe important to kind of lay out too is like that's about a 3 week cough, right? I mean,
Oh,
like, so usually like, and that doesn't always last 3 weeks, but if it does last 3 weeks, we're kind of like, yeah, okay, it lasted 3 weeks. Like, so that's
mhm,
why usually we're like, by the time you get in to see us, it's probably been going on for about a week. And then we're like, yeah, maybe you're going to go on for another week. And then like, you're not going to like let them go anywhere for like another week because it's like a good, 3 week course of disease. But like you said, like really they don't get super punky for the most part. Pneumonia is
yeah,
possible, but pretty rare. And death is like very rare.
yeah,
Very
I
rare.
would agree with that.
Yeah.
So,
So
and
but that everything responds, right? Like so when you do have to intervene, you need to do a cough suppressant, it usually responds. If sometimes they get to that next level where they do, let's say, need some medical intervention, that bug, that complex, that upper respiratory complex, that's going to respond to the medications that we've traditionally used for this particular thing, which we all call kennel cough, but it's actually
it's
canine
it's it's easier to
infectious
call off.
respiratory disease complex. um which they've changed, since we were in school. They didn't call it that, which is it's another one of those fun things, like when they changed hemorrhagic gastroenteritis to
uh, to acute
one acute hemorrhagic.
diarrhea syndrome.
Yes, that's what it is.
It's
But like, you know what I mean, like I still call it
oh,
HG.
every
you
time I'm
know
like still HG, and you new kids, it's still
Yeah.
HG.
Okay. Uh-huh. I like I remember it used to be dentals, and it's like it's a cohat. It's like so we always like every few years have to like change the vernacular. For whatever reason, HG is I cannot change that one. I don't know. I'm like
It was a
becoming
perfect
lazy.
one. It just made sense.
It does. I
HGEM.
don't know. It does. It's so easy to remember. The other one, I'm always like, you shoot, what is it? I don't
I was
know.
like, I don't even know why we changed it. I don't. It doesn't make a lot of sense to me personally.
No, unless
It,
there's like some like cohat makes sense. Complete oral health assessment and treatment. Like that
a lot of sense.
makes sense. It's a very long thing, but it does make sense. Um. Anyway, not to kind of totally go off topic, but so this new one, this new bad kiddo. So tell me about it. Have you seen any?
Yeah, we
Okay.
actually possibly had to put. We think this was the right case, but we had to put a dog on a ventilator for it.
Oh.
Uh, it was on it for it was like a 2 year old dog on it for like 48 hours.
Oh.
Yeah.
Yikes.
So not just that's probably not the one I should start with, not to scare
Yeah,
people.
probably not.
So I'm gonna back that up. We've seen a lot of cases of it. Many times it is just like kennel cough. And then again, it's just that disease complex. It's just like any disease, like we saw with COVID or anything else. One of the suspicions right now is, well, I guess the debate right now, I guess maybe this is what we can talk about, is that either it's a brand new virus that we've never seen before that's causing a problem, or it's just an exacerbation of a previous virus that we already know about, just is having a bad year.
Yeah. Mm-hmm.
And
Or
I guess
like is maybe not as susceptible to our previous treatments,
exactly.
which
I
is
think that's
what makes it maybe worse. The other thing is I have heard of a possibility of like a new bacterium as well that could be
mhm.
part of it, that they've
Yeah.
cultured that in some of the cases. But my understanding is that they haven't cultured it in all of the cases. I think the hardest part for people to wrap their head around, and kind of myself too, is aside from it not responding the way we expect it to, like how are we even proving that all these cases are the same sort of thing, right? Like how do we know all over the country, because it's not happening like in a drift sort of a way. It's not happening in the way that like most pandemics start, things like that, from what I can understand. It's happening in like pockets all over the place.
And part of that might be because of the holiday season and traveling.
Yeah.
People now travel with their pets a lot more. They bring them on planes.
Mm-hmm.
And usually it's only been a human problem Like you go home,
Right.
see your family, everybody's together, and then you all bring your diseases back to your separate state, and it
Yeah.
just
Right.
pockets again.
Right.
Now dogs are part of the problem. Like they're going home seeing
Yeah.
their other, neighbor dogs, and so I think that's something we might have to adjust to as a veterinary profession to understand. Like it might be worse for us too around the holiday seasons too, when people are going back to see family and bringing their pets all the time because they're literally traveling everywhere now.
Yeah. Well, and that's where I think some of these stories of like, well, it I think this narrative has changed maybe a little bit with this particular um upper respiratory disease complex thing that's happening. It is that um in the beginning, a lot of the reports were, oh no, they don't get boarded. It's not a dog that went to the dog park. It's not a dog that went to these like high trafficked area. Now, some of the new stuff, like the article that we were just looking at today, they did say specifically they saw it in like boarding facilities and dog parks and stuff like that. But in the initial reporting of this, and in a lot of the cases that I've heard about, just because I'm on like a group chat with like all the moms with the DVM that are, and they're I mean, I was reading through some of them today just to kind of see what everyone's experiences has been and like where they are. And they're all in places other than where I'm at, right? So I haven't really been in contact with this, but but not all of them have been dogs that were boarded or were, in the traditional way that when we have kennel cough, like my dog when he got kennel cough, I had
Yeah,
literally just boarded him and it was a week later and he was coughing and I was like, well,
you're like,
here's
hmm,
some hydrocodone when we go to bed, kiddo. Like, but you can't have it in the morning. And
right.
he got over it in the right time, and everything was fine. He didn't need any antibiotics. Like, we didn't need to do any of that stuff. Um, so what are you? How are you guys deciding that this is what you're seeing?
Well, I think that's the biggest problem.
Mm-hmm.
Unfortunately, when there's an issue in human medicine, everybody gets tested,
Right.
and it's because you don't have to pay for it. Like COVID, the government paid for it half the time,
Mm-hmm.
or you have insurance that will cover it. Now we're asking owners to, when their pets are already sick, they have to focus on things like antibiotics, sometimes hospitalization with oxygen therapy, and that's expensive. And then
Yeah.
like, oh, by the way, spend $300 to $400 on a respiratory test on top of that.
To
Sometimes that's
see
almost
if it's going to come back positive.
exactly.
Right.
And to ask owners to do that when that $400 might give their dog another half a day in hospital with oxygen, it's hard to do that because they're like, well, I need to focus on like getting them better. Does it really matter what it is right now?
Right.
So we can't track things as well as the human industry does, and that's one of the biggest disparities between our two professions.
Mm-hmm.
Um, and so that's kind of the tough thing. But kind of the going thought right now is that it's not a new thing; it's
Mm-hmm.
just a worse thing, a worse disease that we haven't seen. Like it's been around for a while. It's just worse right now, and for any number
I
of reasons.
also was seeing too that like if they were thinking that was complicated by like mycoplasma and things like that, it's just like certain types of antibiotics just aren't going to work with that. And that's not new. That's always been the case. It's just the first medicine that most people use with an uncomplicated kennel cough is going to be one of those medications that doesn't happen to work with that bug.
Yeah, exactly. And so I think that's what we're kind of learning here pretty quickly is
Mhm.
we have to shift our antibiotic therapy a little bit to
Yeah.
address that.
Yeah.
And that's okay. That's it's and again, most dogs are fine. There's
Yeah, I think it's important to note that, like, yes, you had that one case that was like that, but it's still the what I've seen reported is that death is rare in these cases.
yes, agreed. Death is rare. It's still your dog can get sick just like you get pneumonia.
Yeah,
But at the end of the day, they will still get better just like we get better in most cases.
yeah, and I think too, the course of disease is longer. So our patience for how long it's going to take them to get through it is about double what they've seen with the just like run of the mill like kennel cough, the normal one that we're all used to. And I think that that's really important to know too, because sometimes viral coughs in people, I mean viral coughs like my whole family, I still, I don't know if you can tell, like I'm still a little bit like congested and I have
You
a
look
little
sound
bit of cough. I try, trying to mask it, and speak like not through my nose. But like exactly. But no, but I mean like viral coughs can last for weeks, weeks and weeks and weeks, and it doesn't mean you're getting worse. And as long as your dog is improving incrementally, then that's fine. They don't, you don't need to just keep throwing more meds at them. Um, you just gotta I think
Yeah.
leave it up to the doctor that's seeing what's going on and making sure. I had one case recently just because of this whole thing that I know is going around, and because of the breed of the dog, it was a pug that is also an Addisonian. So, well, and he's an atypical Addisonian, so he's not like on the Percortin, but he is on Pred. When he got sick, I was like, I normally wouldn't necessarily just be like antibiotics right away, but I was like, you know what? We're gonna go ahead and just get you on some antibiotics. Like, and I think it, and I think it was the right thing to do, but that's because he had exposure. He, is a breed that we know is much more likely to have a real problem,
Mhm.
and he has an underlying disease process where he really can't, like, if he gets really sick, it's just going to be a whole nother thing. So, and the owners were financially restricted, so I also was kind of like, well, they can't afford to do chest x-rays, so I'm gonna have to just kind of go with being a little bit extra cautious with him, and he ended up doing fine. So I'm not sure that I believe that he actually had that. That's why I don't really think I've actually had a case of it, because he responded well. And that always makes me think, well, maybe it wasn't that, because he responded
Yeah.
really well, so I don't know.
And that's the tough part. Like we just don't always know which ones have it, which ones don't. Like, sometimes they have a mild case of it again, and but I think it's smart, like especially those breeds, you have to be a little more careful with because they can't breathe anyway, and it's just gonna make it worse.
Yes, exactly. And I know these owners really couldn't have afforded, if he had gotten to the point where he had pneumonia so bad that he needed to be hospitalized. It would have just not worked out well for them. So I was like, well, I don't want this, not that we can always preemptively giving antibiotics does not always mean that your dog's not going to get to that point. So let me just put that out there, because everyone's gonna be like, why are we just giving me antibiotics every time? It's like not always the right thing to do. It's just I think clinically that was just the decision I made. Um,
Well,
and
that's do too, right?
hmm,
Because like if a person's this pug wasn't immunosuppressed, but it's our version of immunosuppressed.
I mean,
Uh,
a little bitty. I mean, because technically he's not on that high of a dose of prednisone, but he has been on prednisone for a very long time.
yeah.
So it does it. I have to believe that there could have been a bit more susceptibility, and also too, like I picked Doxy because I was like, well, he's already on something that should be somewhat anti-inflammatory, but he's still all inflamed, and at least with Doxy, like, I get that secondary um anti-inflammatory effect. So that was the other reason why I was like, well, we're gonna kind of take advantage of this right now and use it.
Absolutely. We treat our breeds. That's the whole point of having different breeds. We treat them very differently. Like
Right.
I would
A
probably done the
lab
same.
bouncing around, I would not have done that. I would have been like, yeah,
Oh, but like a pug, I would do the same thing. I would have been
yeah.
like, yeah, you're getting some because you're on pred and you're a pug. Like you already have a hard time breathing.
Yeah.
Kind of treat a person like whether they're immunosuppressed or they have a history of bronchitis. Like you treat them a little more aggressively in the beginning because you know they have a problem. The
Right.
pug's problem is breathing. So we're just being smart about it. So I like it.
Yeah. Yeah. I tried. And
I
it's
support.
interesting. It's interesting because we have gotten a lot of like the local news people were like, hey, can you guys give us some information about this new disease? And that was like very early on in the beginning. And I was like, we haven't even had anything from our state vet yet. And so we did actually finally just get a bit of a statement from our state vet, which mirrored a lot of the things that you're saying. Like, yeah, we're not 100% sure if this is something novel. We really can't prove that at this point, meaning that it's new when I say novel. Um, or is it just like a more serious version of what we see every single year? And at that point, being in Indiana, the only place that if they had reported it were like Indy, which is about 3 hours south of me, and then
Okay.
Fort Wayne, which is about an hour and a half east of me. And so really like in our, in the South Bend area, we really hadn't seen anything that had been to the point where it was reported and the state vet knew about it.
Well, and I wonder if a lot of this, and I have to check out the demographics of like where, I guess, yeah, the where it's being worse right now, but it's a little colder in Indiana right now.
Mm-hmm. Yeah.
Probably not a lot of dogs going to dog parks and hanging out, whereas California, it's still 75 and people are going to the dog parks and dog beach. Sucks to suck. But the point is, in warmer climate, I wonder if it's worse in climates right now because dogs are more interacting with each other.
Yeah.
and it's gonna spread around a little quicker as opposed to it's a little chillier or like cities they're out and about a little more. So
Yeah. Although I'm gonna just say that it was like 50 degrees here the other day.
oh wow, look at you
So, you
guys.
know, it was like, I mean, it might as well have been spring, okay? And just as a PSA, I mean, I know we're talking about upper respiratories, but I have taken fleas off of so many dogs and cats in the last 2 weeks. Don't stop your flea preventative.
Dr. Sam's PSA for the
I
week.
mean, everyone's like, I can stop it in the winter. I'm like, I'm sorry, it's 50 degrees out. Do you think it's winter yet here? Maybe in February. But no,
It's
even
very
that I
real.
don't tell people to, but
It's very real and it drives me nuts. Like it's
yeah.
what fleas, especially because I got a few friends and everyone's like bring their dog over and like they're off flea preventive because like it's not that cold. I'm like, or it's like cold. I'm like, it's not that cold here in San Diego in the first place, and fleas are around all year long. Does even in the like they've shown them they're literally around in all year long, all climates. Like,
Yeah, but I mean, like, and even here, yeah, okay, it was freezing like a week ago, but then it's above 40 degrees. Guess who doesn't care that it was freezing a week ago? Please.
and tick
And
and
ticks.
ticks, they're both bad.
They really don't. It can be frozen and ticks will still be out and about. So, yeah, I'm like telling people, I'm like, no, no, you don't have a winter. I know you think you do. I know you're cold, but they don't care.
Oh God, that's funny.
Yeah.
But I think something, and I'd love to hear your thoughts on this.
Yeah.
We're getting a lot of phone calls. Owners are a little more panicked,
Hmm.
especially with the upcoming holiday season. A lot of people do board their pets, and
Yeah.
they're like, "We do." So, what advice is your clinic giving them? What's the best next steps?
Well, I think the hardest part for us is we haven't seen it. So
Yeah,
it's also, you know what I mean? I mean, the fact of the matter is the only thing that I know of at this point in time is making sure they're all vaccinated, you know,
yeah,
up to date on their vaccine. Um, so like I still think get them their Bordetella vaccine. Is it the only upper respiratory infection they can get? No, of course not. But definitely do because it is infectious and we don't really need them to get that. Number two, even just their distemper. I mean, most of them have at least two upper respiratory diseases in that itself as well. So
yeah.
making sure they're up to date. Now, I don't know many boarding facilities that you would be able to go to without doing that. But I can tell you, I boarded Gus over Thanksgiving, you know,
Mhm.
and I'm gonna have to board him over Christmas. So, you know, it's one of those things where I'm still gonna do it. So, you know what I
Yeah.
mean? I guess if I tell people, you know, if you're really that uncomfortable with it, then hire someone to come watch them at your house. Like, don't, you know, but I think that the fact that at least in the beginning, dogs that were not being boarded and hadn't necessarily had exposure were coming down with this. To me, I'm kind of like, I don't know, you can't put them in a bubble, but that tends to be my philosophy in general. So curious to know what you think.
Mine's not much different, to be honest with you. There's
Mhm.
not much you can do. Like, if you have to leave, you have to leave.
Yeah.
Uh, yeah, it's great if you can have like. I'm fortunate. I always have one of my technicians who are lovely people come stay at my place and they'll
I hope
watch
you
local
do
dogs
something
on.
very nice for them, Robert.
I will be doing that. I yes, they're lovely people and I really appreciate them. And I actually don't think it's a bad option for a lot of owners, especially if you have someone who's staying around that can watch your dog. Um, get vaccinated early. I think it's the most important thing.
Oh yeah,
Like
don't wait until 2 days before. You want to have it on board a good week before.
exactly. I think a lot of like you'll get into your boarding facility if you could do it like 2 or 3 days beforehand, but that doesn't count. Like the immunity isn't built up for it. So you're still the dog's still exposed while they're there. So get vaccinated early. We know it's kind of close now because what we're December 12th. So like do it ASAP.
Yeah.
Yeah, like this week. But yeah, try and get it done early. I think that's a big thing. And then just avoid if you can avoid dog heavy areas, avoid it. You don't need to panic about it, but like if you got a high risk dog in particular,
Well, and that was the last thing I was gonna say too. Is like, to be fair, Gus is 3. You know what I mean? Like it's not the same thing. And he's healthy, he doesn't have any like predispositions. I would
mhm,
say if your dog is elderly, if your dog is immunocompromised, if your dog you know, has really any sort of like really bad underlying diseases, diabetes, like things like that where having an infection is going to also make that worse. You know what I mean? yeah, those are the ones that I'd probably say maybe it's not worth the risk, or see if you can bring the dog with you, or see if a fan like somebody else can watch them. But at the same time, there's always infectious things around. There's always bugs around. You can't put bubble wrap around your dog and like not let them live their life. They have to. You cannot, So unfortunately, I wish we could, but we can't.
No, I 100% agree. Like you gotta kind of roll with the punches a little bit on this one and just be smart, but you
Yeah.
can't change that much.
You really
Um,
can't. I mean, the thing is, like, I'm immunocompromised, and like at some level, it's like, okay, like I try to take care of myself. I try to be healthy, but I'm not gonna put myself in a bubble and not live my life. I gotta get out there. So guess what?
and
I get an extra cold a couple like a year once a year. You know what I mean? Like it's fine. I'll be okay.
meanwhile, you're being superwoman at home because you're taking care of a bunch of sick kids, and
Well, to be
uh,
fair, I'm just getting over being sick, and my husband tore his ACL, so but he's getting around really well right now, so that's good. He
that's
had
good.
I guess I should put that out there. He did have surgery. He's like almost 3 weeks post-op now, 2 weeks, 3 weeks post-op, so he's doing really
Okay.
good. About 3 weeks, yeah. So
Well, we
he's
all wish Paul a speedy recovery because we love Paul, and
we do, and he has been a rock star, and he was, I mean, really good through the entire thing. He had such a good outlook, and he's in PT now, so he's like just being gonna get strong. So it's
can't
good.
wait. I can't wait to see him on the basketball court again. So it's gonna happen.
I don't know. I'll might kill you if you didn't make him play basketball. I don't want him to do it again.
Is I'm curious. And so in dogs, there is a thing where if a dog tears ACL, they're like 50% more likely to tear the other one. Is the same true in people? Because I don't know.
I don't think so. Like they didn't say that to him. He wasn't like, "So we'll see you back in a year." Which
Right.
is like the joke we make with dogs. Not that it's funny, and we're not like we don't ever really want that. But no, I do always warn people. I'm like, so
You'll
probably
be
gonna
back.
see again in a year for the other knee. No,
Right.
and he had an awesome surgeon. I mean, I know this has nothing to do with canine upper respiratory infections, but like, but he but yeah, he was great, and they just they communicated really well. He knew exactly what to expect. They did such a nice job. I really appreciated it because I haven't always had that experience, like going through the diagnostic process, like and
Yeah.
getting treatment and stuff like that. Sometimes I've found it to be like very frustrating and take way longer, which I think we're gonna have to talk about that on another podcast, which I think we might.
Like a
That prob-
brilliant idea.
yeah. Who thought of that one? Robert. But anyway, but no, but truly, I do think there is something to understanding what's happening and giving people time to figure out how to help you and what to do and all that kind of stuff. But there is something to also having to be your own advocate and making sure that you're getting the care that you want. And I would say, like, we didn't even have to do that. Like, they just did such a good job from start to finish. Um, they did great, and he had such a good experience. And I'm just really happy because he's healing really nicely. Um,
Awesome.
yeah.
Well, that's awesome to hear. We want that for Paul, and can't wait to see him out again.
Oh yeah, I know. Well, can't you got to come visit? I told you. We have a
I do.
room just waiting for you.
I know. I figured I'd wait not to come around when everybody is like sick or
This is not a
surgerized.
good time. Yeah, yeah.
I was
It is
like,
also winter.
yes. Well, I don't mind the winter. It's sometimes nice to revisit the cold to remember my roots.
To remember why you live in San Diego.
It happens very quickly. You're like, oh, that's why I don't live here anymore.
Oh yeah, that's right. I have to warm my car up for 10 minutes before I sit in it. Oh, yeah, that's
Yeah,
it. I
yeah,
don't
I'm
miss
good. I
that.
don't do that anymore, and it's lovely.
Yeah, I'm not built for the cold. And I grew up in New York, but I'm not built for the cold at all.
Join us. So, but
But getting back to upper respiratory infections.
you know,
Um, but I do think so here's my question. Are you thinking that because of this infection, do you think people should seek care any sooner than they would had it just been the other, like not really any fear of some new thing going on?
no, I think I'd be more vigilant of it and just being aware of like if your dog is eating, if they are acting punky, um, if you are seeing changes in their breathing, and it's very important to note like changes in breathing, like when they're not actually coughing, like that doesn't count. It's
Yeah.
like when they're actually just walk around the house and you see them going
Yeah.
that type of breathing. I don't know why I did that. People don't really see that, but yes, the whole point is,
It was a very good reenactment of dyspnea.
thank you.
You're welcome.
But yes, if you do it too many times in an exam room, it's just a habit. But yes, any of
That's
those
like
three,
whenever I do a reverse sneeze. Like people are like, "Wow, you're really good at that." I'm like, "I know, I know,
like I've had years of practice.
I know." I did live with a Frenchie, so
They are, yes.
yeah.
But yeah, I think that's the big things for me. What anything for
And I
you?
think like be mindful too, what we were saying before about breed, right? About breed, about age, about those dogs that like are in a situation that we would expect things to maybe be a little bit harder on them. And I would say I never have patience for an animal that isn't breathing right. So with this being here or not, if your dog is using their abdomen to breathe, that's a problem. If they're like working hard or breathing fast when they're sleeping, that's usually a problem. And I'm not talking about dreaming and like where they're like, oh, like making like weird noises, like, oh, you know, you're like, I'm not talking about that. Like I'm talking about like when they're like totally at rest. If they're using their abdomen, there's a problem.
Yeah, 100%
You
agree.
know, yeah, and especially if you're hearing wheezing, if you're hearing anything like that, I mean, no matter what, just get it checked. But yeah, if they're bouncing around, they're playing, and they have no idea, and they're eating, and they're acting totally normal, they just happen to have a cough. I think document when it started,
Yep.
and just watch it every day and make sure, and if it's productive like you said, Robert, that's okay. Like let them get that gunk up. It's okay. It's okay to like you can like let them have humid room, bring them into the room when you're taking a shower, let them get a little steam. Like that's all okay.
Mm-hmm.
Some of the conventional stuff, that works. But I would be careful trying to administer cough suppressants to them without getting advice from your veterinarian.
Mm-hmm.
Um, and certainly some of the stronger cough suppressants, like I agree with you, Robert, you don't want to suppress a productive cough all day, but at night, everyone should get some sleep. That's going to
Yeah.
help them heal. That's okay. Um, and yeah, don't just throw your dog on antibiotics if you happen to have some left over. Don't do that.
Yeah. Because a lot of times they're expired, they're ineffective, and the wrong antibiotic here builds super bugs at the same time. So don't do that.
Or they're the wrong dose because they're from a different dog. Don't do
Yes,
that either.
that
Yeah.
happens a lot. And yeah, I think that's about it. Just and yeah, don't rush them in if they are doing fine because they can pick up an infection at the hospital just as likely as they can anywhere else.
Or spread it to somebody else. I mean, they may well have something that is contagious.
Yeah.
And so maybe let them know, hey, I'm coming in with a cough that I suspect is an infectious cough because they may have a protocol where they don't
Yeah.
want you just to walk right in. They might want you to stay in your car until they can bring them in or bring them in the back or keep them in isolation. I mean, lots of hospitals have their own way of dealing with it. And so they don't want to spread it to other dogs. Um, oh, I guess the other thing that people ask, can they spread it to people and cats? I'm gonna go with
No,
no.
yeah, no evidence right now. Yeah, you're all safe.
Yeah. I had a lot of people call about COVID and stuff like that.
Yeah.
In fact, especially like when people were really hauled up like in their houses and like, for extended periods of time, it's a lot shorter now. But like, I mean, I get the fear, but yeah, it's
Hmm.
pretty rare for an animal to get COVID and it's mild and self-limiting, so I wouldn't worry about it.
Yeah, thank God.
Yeah. I mean, I don't actually think there's any like real reports of that even happening in the States. Like I think the only report was in China.
I have to look it up, honestly. I thought they had a couple that were it was like weird animals. It wasn't like a tiger or something like that. And
Yeah, yeah. That's why I was thinking domestic animals and not so much a tiger.
tiger is domestic. No kidding. Uh, all
Yeah,
I
if you
want.
live at the Bronx Zoo, I guess that is domestic for you.
That's all I wanted. I just wanted to have a tiger growing up.
Yeah,
So, but yes, I think that's as long as you be smart about it, your pets will be fine.
yeah. And at the very end, just call your vet. Like if you know what I mean? Like if you really aren't sure, call your vet
Yeah.
and then trust them when they say it's mild, self-limiting, and you don't have to do anything.
Hmm. Or you can always email us at
Oh,
mybalto.com for specific questions. Now, if it's life threatening, don't get your ass to a vet.
oh yeah,
But
yeah. No, if you even think there's a question that your dog can't breathe, you get them to a vet for sure.
yeah, we
And
don't answer our emails that quickly. So,
yeah. And we're certainly not downplaying this. I mean, there are some serious cases. And I think that you need to, listen to your vet, trust your vet. If they're telling you that it needs to be medicated, it needs to be monitored, it needs to be watched, then yeah, absolutely do it.
Mm.
But I also want to give people peace of mind that, it doesn't, just because your dog's coughing doesn't mean they have this horrible virus.
Yep. Agreed.
Yeah.
Yeah.
Look at that. We didn't even talk about this ahead of time, and we ended up agreeing again.
I know. Sometimes I always wonder, like, are we ever going to disagree on a topic? But
I don't
maybe it's
know.
doctors, so it's great. No.
Well, I mean, do you think it comes down to the fact that we went to vet school together? Because I don't think everybody we went to vet school would agree with everything we say.
It's a good question. I learned so much though in my internship, and that's where I did very different things from you.
That's true.
Uh, so I think that actually played, like, I was a shitty doctor coming out of state.
I don't think that that's even possibly true.
I think experience just plays a huge role in how we are, and I learned so much in my internship, and yeah, it just like leaps and bounds. So I think a lot of what I learned there. So I think I would normally agree with you is just that experience. I'd say yes, but we diverted a lot. I think
We did. I think we just look at life very similarly, and maybe that's probably why that we've come to the same conclusions. Although it is kind of interesting having vastly different experiences.
mhm.
Like every day, our work lives are so different.
That's why we get along so well. It's great to share
I
experiences. And
know, it's great. It's perfect. It's wonderful. It's just really funny. There are definitely people that we went to school with that would just disagree with us, like to be disagreeable.
yes, there were.
I don't mean in a mean way, but I mean in like a let's just have a let me just have a different idea just so we can have a conversation about. I don't mean like in a
Devil's advocate type of thing.
that's what I mean. Yeah, yeah, yeah. That's what I mean by that.
Uh, there was a couple like that, and I was like,
Like just for the sake of being contrary. You're like, but you don't even agree with what you're saying.
"You're just making my life difficult, and I don't need that anymore."
Yeah, yeah. Well, now that we're big kids, we really don't need that. We've got plenty of things going on. It's cool.
I'm a big boy now. I can do
You
things.
are. You're like a real certified big kid. So I'm real proud of you.
Oh, proud. Oh Lord.
Oh my goodness. Well, this has been really fun. Just getting to chat with
Yep.
you about
Good.
canine infectious respiratory disease complex. And
Yep.
if people do have any questions, and actually we'll update. Like if we find something new or if something really does come to light and is like really truly culture different or something like that, we'll definitely update. Um, but just trust your vets. We're all talking to each other. Like I said, like everybody has friends and people who are experienced with this and treating it. And if it ever comes to it and your pet does get it, like there's people who do know how to treat it. So I don't want people to panic.
Yeah, I agree.
Yeah.
So,
All right. Well,
cool.
this has been the Pause It podcast. I hope you've all enjoyed it. We had a great time. Thanks so much for listening.
See you later, Sam.